So structural empowerment are the processes and structures that organizations put in place to allow people to function fully in their roles. The project was about creating a fully functional team with a nurse practitioner functioning as a unit-based provider in that team. So it was in the acute care environment, so the function of that nurse practitioner working with the acute care team, the full team, including nurses, physicians, physical therapists, was really important. The nurse practitioner took an active role as the leader of that team and focused primarily on the needs of the patients and families as defined by a very structured process to determine those needs.
When we started this project, we wanted to look at the literature and see what was out there as far as nurse practitioner-led teams. And when this project was put together, we really divided it into, we looked largely at inpatient with the goal ultimately to go across the continuum. But we looked largely at inpatient and really divided the different teams that took care of the patient into 3 groups. So there were the primary team, there were dynamic intervention teams that would come in and focus on a particular aspect of that patient's care, and then there was the unit-based team. And so when we went into this project, as far as having a unit-based nurse practitioner to lead the team, we wanted to look at the research out in the literature as well as research within our own organization. So we were able to show a decreased length of stay, a decrease in hospital-acquired complications, decrease in readmissions, all those different things that were as a result of having teams that were put into place with structural empowerment.
Well, there are a number of benefits. One is that they are really good at protocolized care and managing the full needs of the patient. So they are very attuned to both the physiological needs but the psychosocial needs of those patients as well. So they really do a great job of coordinating all of the care and working with the other team members to provide that in a very effective manner. So I think it's very important to look at the needs of the population from the perspective of the patient and family and really determining what needs are not being met by the existing team. And the nurse practitioners really fulfill an excellent role with both their clinical skills and, again, the concept of care coordination and holistic care. So I would work individually with those providers to really determine what the needs are for their population and then get the right nurse practitioner in the right place to meet those needs for the patient and family.